regardless if you're trying or not to teach a child, the child's learning by observing you. So if you show interest and you show importance in the education your child is getting, then the child will grow up knowing that it's important for them to learn and have education throughout their life.
You know, like everybody else, health and wellness became front and center for the parents. And we captured that in our program through some of the questions we were getting from parents, and also I would say some of the demands the parents had around supports that we could have in place. For example, mental health support for the children, as well as access for parents who were needing mental health services. As well, you know, with the pandemic, parents also became more aware of some of the impacts that health had on attendance and ability to participate in the program. For example, when a child had symptoms and couldn't come to class, then the parents were doing the follow-up with the providers and then talking again with our staff about what that meant in terms of their participation in the program. What I would say in terms of how parents are engaged with health and wellness, I definitely feel like there's a heightened awareness of what that means in connection to school readiness, how a child's health impacts their ability to participate, to be ready to learn, as well as to how the child is able to engage with other children or their care providers.
Homelessness takes a big toll on children's health and wellness, not just on the children themselves, but on the whole family. And that families do experience things such as challenges such as transportation challenges, continuous care, or finding somebody that is, a consistent provider for them. So we do see a little bit more of like switches depending on where the family is staying or couch surfing. And we've actually seen that homelessness actually takes a long-term toll. Something that I am proud of for this program year is definitely our program's response to the pandemic. We have offered an array of services to families, and we've made our best effort to provide consistent services to them. We've shifted so much as the pandemic has changed, as surges have happened, as protocols have changed, and we've really strived to continue to provide consistent services to every child and every family. The pandemic has disrupted learning due to longer absenteeism rates for children due to symptoms or positive COVID cases, especially during the surge that we saw this January and February at the beginning of the 2022 program year. We saw a lot of children falling behind in their annual physical exams, especially the dental exams. And we've seen an increase in families now accessing some of those services. And we have seen an increase in mental health requests, but a decrease in availability of mental health providers in the community. And that has been impactful during the pandemic. One of the biggest community partner support that we've received this program year has been from the Santa Cruz County Office of Education. That collaboration has been invaluable for our program because they have given us updates on the pandemic and protocols on a weekly basis since the beginning of the pandemic. In addition, they made vaccines as well as testing accessible for our families and for our staff. So that's definitely made a world of a difference in our program.